Yeah.
Yeah.
Hello, everyone. Yeah. Hello, everyone. I welcome you today to the session of pelvic infections and infertility by Apollo Fertility. To speak on this topic today, I would like to welcome Dr. Pratima Gangurde. She's our
Thank you.
in-house IVF consultant with Apollo Hospital in Borivali. To give her a brief background about her, she has done her MBBS and DNB, and she's also specialized in IVF procedures. So, doctor, we welcome you today to this session, and it's all yours. We are very keen to learn about
Yeah.
these things from
Thank you
you.
so much for your kind words. So I think this is a very interesting topic what we are going to talk about today, and it is pelvic infection and related infertility. So though it is not very much discussed, but it is a very important reason for the increasing incidence of infertility in society. So that's why I thought we should go ahead and discuss this topic with our patients or our ladies today. Okay, so I think we'll go one by one. First of all, if you see what exactly is a pelvic infection. So pelvic inflammatory disease or pelvic infection is a infection of a female reproductive tract, and it is most commonly happening in the sexually transmitted diseases and spreading from vagina to uterus to fallopian tubes and to the ovaries. Okay, so the signs and symptoms are many a times mild. The patient doesn't even realize that she has got a pelvic infections. Many patients will report to the OPD with the complaints of a vaginal discharge. They will typically tell us that yes, doctor, white पानी जाता है और गीला हो जाता है, itching भी होता है, पेट में हल्का दुखते रहता है. So these are all very common symptoms described by the patient, and they may have pain during intercourse. They may have pain on and off in the lower abdomen. With some patients, maybe with severe infection, may have fever and other symptoms also. So, but the majority of cases they will have subtle pain, and that will be usually mild pain, and they will be reporting to the doctor after a long time, which is probably really taking a toll on them. And I will tell my patients that please report to the doctor as soon as possible, because what happens is when you report late, then the damage is more. The damage is already occurred, and the doctor there is very little what the doctor can do about the disease. So it is very important screening, what we call it as prevention, then screening, early treatment, early diagnosis. Okay, very important. So what are the we'll just discuss about the symptoms of the patient. So signs and symptoms of PID are mild and difficult to recognize. Some women don't have any signs and symptoms, and when signs and symptoms of PID are present, they most often include pain, which is ranging from mild, moderate, severe in the lower abdomen in the pelvic area. Then abnormal or heavy vaginal discharge may have an unpleasant odor, and abnormal uterine bleeding, especially during or after intercourse or between the menstrual cycles. जैसे पेशेंट बोलता है कि डॉक्टर मेंसेस आने से पहले भी या फिर बाद में भी स्पॉटिंग होते रहता है. Okay, so commonly described by the patient. Then pain during intercourse, as we discussed. Then fever sometimes with chills, and painful and frequent and difficult urinations. Obviously when the bladder area is also affected. Okay, because uterus, bladder, rectum, they are in very much close vicinity, and that's why the patient will have related symptoms. Then, so when to see your doctor? As I said, if you're reporting early to your doctor, then doctor can help you better than when you report very late to a doctor. That there is very little in the hands of the doctor also to do about something about it. So severe pain in the lower abdomen, nausea, vomiting with an inability to keep anything down, then fever with temperature higher than 101 degrees Fahrenheit, foul smelling vaginal discharge. Please report to your doctor and describe that you have got all these symptoms. Okay, so if you have signs and symptoms of PID, they are usually not severe. Still, you see a doctor as soon as possible. As I told you, don't wait for the severe symptoms to appear, or don't wait for the symptom to be chronic and then report to the doctor. So, vaginal discharge with an odor, painful urination, bleeding between the menstrual cycle can also be the symptoms of STD, which is sexually transmitted infection or sexually transmitted diseases. If these signs and symptoms occur, stop having sex and see your doctor as soon as possible. Prompt treatment of any infection help to prevent pelvic inflammatory disease, which is going to have symptoms of infertility in future. So, what are the causes? What are the causes of pelvic inflammatory disease? Many types of bacteria can cause PID, but gonorrhea, chlamydia infections are the most common ones. These bacteria are usually acquired during unprotected sexual intercourse. Okay, so less commonly, bacteria can enter your reproductive tract anytime the normal barrier is created by the cervix is disturbed. This can happen during menstruation, after childbirth, miscarriage, or abortion. Rarely, the bacteria can also enter the reproductive tract during insertion of intrauterine device, a form of long birth control, as you know, all of you know, property, a medical procedure that involves inserting instrument into the uterus. So, I mean to say that unless and until the barrier of a cervix, what we call it as external loss, internal loss, is undisturbed, the the uterine cavity is quite a virgin cavity without any infection. So whenever there is infection, this barrier is somehow disturbed. The infection is easy to go to the upper genital tract. Okay, so vagina, then cervix, then there is a door between the uterus and the cervix. What we call it as internal os. We can call it as a wall like, because it is something which is protecting the uterine cavity from getting infected. And once it is disturbed, the infection is going to the upper part of the genital tract, which is uterus and tubes and ovaries. Okay, so this happens during the procedures like, as I told you, insertion of intrauterine contraceptive device, or procedures like DNC, missed abortion. Okay, deliveries. It can happen after the delivery. Okay, so this is the most commonly the cause behind the pelvic inflammatory disease. So, what are the risk factors? So the number of risk factors which might increase your risk of PID are including being sexually active, a woman younger than 25 years of old, because they are usually unaware of many things, and then the other factors like hygiene and all, and how to protect themselves from sexually transmitted diseases. And having multiple sexual partners, being in sexual relationship with a person who has more than one sexual partners, having sex without condom, that means barrier contraception, which is not, if it is not protected intercourse, then obviously you're more at a risk of having a PID. Then douching regularly, which upsets the balance of good versus harmful bacteria in vagina and might mask the symptoms. So many people, they do tell me that, doctor, we use Dettol, we use Savlon to clean the private parts, or we wash our undergarments or inner clothes in Savlon or Dettol. So I prevent them from doing that, because definitely that is going to disturb your epithelium in the local tissues, and which is a very good invitation for the bacteria to invade and cause further infection. So please beware that not that your Dettol or Savlon is going to protect you against the bacteria. No, the normal vaginal flora are essential to maintain the internal environment of the genital tract. So having history of a pelvic inflammatory disease or sexually transmitted infection is again another risk factor for PID. There is a small increased risk of PID after insertion of an intrauterine device, and this risk is generally confined for first 3 weeks after the insertion. But then, obviously, once we insert copper T, many times we give good antibiotics like norfloxacin or doxycycline to prevent any infection, and which is effective against the bacteria which is going to cause PID. So, very important, after a copper T insertion, it is better to give antibiotics, and some even to cover with some vitamins which are deficient in the patient. So, basically, to maintain proper nutrition, proper health of the patient, and to cover with the antibiotics, very important. So, what are the complications of pelvic inflammation? Untreated PID, that is pelvic inflammatory disease, might cause scar tissue and pockets of infected fluid, that is called as abscess, to develop in the reproductive tract, and these can cause permanent damage to the reproductive organs. Okay, so the complications are ectopic pregnancy. So PID is a major cause of tubal ectopic pregnancy, because just like we usually discuss that when we were doing our residency during our MD, I think not many people were coming with a ectopic pregnancy. The incidence was very low, and suddenly after so few years, the incidence has really increased. Ectopic pregnancy, I think this PID is a cause behind that. So, PID is a major cause of tubal ectopic pregnancy, and an ectopic pregnancy can occur when untreated PID has caused scar tissue to develop in fallopian tubes, and the scar tissue prevents the fertilization of the egg from making its way through the fallopian tube to implant in the uterus, and instead the egg implants in the fallopian tube. Ectopic pregnancies can cause massive, life-threatening bleeding and require emergency medical attention. See, it is all about the patency of a tube as well as the function of the tube. So, whenever there is infection, tube is the most delicate organ, and I think it is the first one to get affected because of even a mild infection. So, when there is, just like I told you, there is development of a scar tissue inside the tube, which prevents the motility of the tube, which is the normal function of a tube to push the embryo inside the uterus, fertilization of the egg with the sperm. So, very important. So, this function is affected, and that's why these people will suffer from infertility as well as more chances of having an ectopic pregnancy. So, infertility, damage to your reproductive organs may cause infertility, the inability to become pregnant, and the more times you have got PID, there is a greater risk of infertility. Delaying treatment for PID is also dramatically increasing the risk of infertility, because tubes are the ones which are carrying eggs to the eggs and sperm together, the formation of the embryo, transfer of the embryo into the uterus. So, tubal function, tube is acting like a bridge. So, basically, when the tube is damaged, only IVF is most of the time solution. But obviously, that has got other complications like ectopic pregnancy and all, just like we discussed. Then other thing is chronic pelvic pain. PID, pelvic inflammatory disease, can cause pelvic pain that might last for months or years. And scarring of your fallopian tubes and other pelvic organs can cause pain during intercourse and ovulation. These females will typically complain of a mid-cycle pain, and they will again complain of a pain during intercourse, as we discussed. So, I think we should take one question here. Mrs. Arati Dharmadikari is asking about how does it affect the fertility. Yeah, as we discussed, pelvic infection is affecting your cervix, uterus, tubes, ovaries. So basically, any infection is causing damage to the tissue, and whenever there is healing of any tissue, it is by fibrosis, that is replacing the normal tissue. So these people will obviously have more commonly they will have tubal factor. The tubes will be blocked or non-functional, which is interference in the process of fertilization and implantation. So these people will have infertility, more of tubal factor. Obviously, there will be effect on the ovarian reserve also, which is again leading to infertility. Other question is, what extra precautions should we take to prevent PID during the fertile period? So yes, we are coming to that. As I told you, the intimate hygiene very important. Not to use many. Antiseptic solutions what many people are using, like Dettol or Savlon, or excessive use of talcum powders, or what you call the disturbance of intimate hygiene. Like many people, they are using tight undergarments or some other synthetic materials, which is causing local injury, disturbance of a local epithelium. So there are many other lactobacillus soaps are available, or lactobacillus tablets are available, which are usually given for these patients to prevent the disturbance of the natural flora, and finally preventing infection to some extent. Then other complication is tubo-ovarian abscess. Obviously, ovaries and tubes are in communication. So through cervix to uterus, then tubes, and then through to the ovaries. So tubo-ovarian abscess, PID might cause an abscess to and a collection of a pus to form in the reproductive tract. And most commonly, abscesses affect the fallopian tubes and ovaries, but they can also develop in the uterus and in other pelvic organs. If an abscess is left untreated, then you could develop a life-threatening infection. So any abscess, obviously, if it is not untreated, then obviously the other organs are in the vicinity, and the infection will keep on spreading everywhere. So what is the prevention? What how to prevent it, as the patient has asked me. So practicing safe sex, as we discussed. Use of condoms every time you have sex, and limit your number of partners, and ask about the potential partner's sexual history as far as possible. I think one thing remain untouched is that the sexual partners, if they have got infection, if they are suffering from diabetes or something, then obviously the chances of infection are very high. This is how we come across many a times, that the husband is having diabetes and the sugars are uncontrolled, and the wife is suffering from the infection and pelvic inflammatory disease, and finally infertility. So this is how it is interrelated. So it is very important to take care of these factors. So one should talk to the doctor, obviously, about the contraception. Many forms of contraception do not protect against the development of PID. Yeah, obviously, like oral contraceptive pills, they will help you to prevent an unwanted pregnancy, but then that is not going to help you to prevent the infection. So using barrier methods such as condoms help you to reduce the risk, and even if you take birth control pills, the use of condom every time you have sex with a new partner to protect against sexually transmitted diseases very important, because both are serving a different purpose. Or whatever oral contraceptive pills are going to prevent your ovulation, and that is preventing unwanted conception and pregnancies, and obviously barrier contraception like condoms are going to protect you against the sexually transmitted diseases, though the success rate of condoms to prevent pregnancy is not very great, but then yes, it is definitely a help for preventing STDs. So obviously get tested for sexually transmitted diseases and make an appointment with your doctor for testing, and set up a regular screening schedule with your doctor if it is needed. Yeah, so early treatment, as I always tell people, that when you have mild symptoms, then only you report to the doctor. Very important, because early diagnosis, even done during the screening, just like pap smear has got a fantastic effect. And I think the incidence of cervical cancer has really gone down because of the severe, what I tell you means the severity of the disease, obviously, because it is diagnosed early, right? Because cervical cancer obviously has got a long incubation period and it will take years to develop. So when you are finding any disease at a particular time at a mild level, it is always easy for us to treat, and recovery is also better, the mortality and morbidity is also better. So very important, awareness is very important, to visit to your doctor, not to feel shy, and obviously discuss your problems. Many females are not coming out with the problems like vaginal discharge, the bad odor of the vaginal discharge, or lower abdominal pain. They feel shy and they don't report to the doctor, or they just feel that this will just recover and they will be fine in few days. No, please visit to your doctor so that you don't face the complications like infertility and severe pelvic infection in future. So what are the other things? So yeah, obviously another thing, that please don't douche, as I told you, that the douching with the antiseptic lotions like Savlon or Dettol or Betadine, whatever it is, not because, see, that is going to disturb the local delicate epithelium, which is again a good source of infection for the that particular local area. So and then obviously leading to bacterial infections, super infections. And obviously request your partner to get tested, because I don't know how feasible it is in our scenario, but yes, definitely both the partners should be tested whenever there is some infection in the lady, or if she's suffering from infertility, she's suffering from some chronic pelvic pain. Both the partners should be investigated. Many a times, to your surprise, you'll see that the husband is suffering from diabetes, but he was never tested and he did not feel the need of testing himself, or he's having some infection like sometimes vesicles on the private part, and that is suggestive of a herpes infection. But then we usually miss that part, and even if you treat the lady, she will again be in contact with her husband or a partner, and the infection recurs again. So very important to tell your partner also to get tested for it. So what is the so how to do the diagnosis? So diagnosis is, there is no one test which can accurately diagnose the pelvic inflammatory disease, and instead your doctor will rely on combination of findings. So first thing is medical history. Obviously, the doctor will ask you about the sexual habits, the history of sexually transmitted diseases, and birth control. Birth control things like I discussed with you, like barrier contraception or oral contraception. What kind of contraception you are practicing? Okay, the doctor is going to ask you about that. What are the signs and symptoms? As we discuss, the signs and symptoms are like lower abdominal pain, foul smelling vaginal discharge, bleeding between the menstrual cycles. Okay, sometimes fever with chills, chronic lower abdominal pain on and off. Okay, so all these things. And very importantly, pelvic examination is also going to help us. During examination, that we tell you to check, we check your pelvic region, we check for the uterus, we check for the fornices, we call it as, that is the lateral part of the uterus, whether there is anything else other than the regular anatomy. Okay, so if there is any abscess formation or cyst formation or some mass over there, okay, so we try to locate all those things in during your pelvic examination. Then obviously blood and urine tests are going to help us whether it is having any infection, like urine showing any infection or blood showing any infection. Then ultrasound, fantastic investigation for a gynecologist. I think it is less expensive and it is going to provide us a superb information, fantastic tool for diagnosis. So this is going to help us to see whether obviously the adhesions and all difficult to see, but then tubo-ovarian masses, yes, we are going to diagnose. Or if there is pelvic adhesion or something, then definitely the collection of the fluid inside the pelvis and all we are going to see over there. Okay, but obviously tubal factor like tubal blockage or tubal damage, it is difficult to see on ultrasound. Many times people will come with HSG reports to me, but I think that is insult to injury, because if the patient is suffering from pelvic inflammatory disease and she is going ahead with a hysterosalpingography, then she is again probably going to suffer from a chronic pelvic pain, because ideally it is contraindicated. This kind of procedures are contraindicated if the patient is having a pelvic infection. So, but then yes, we many a times after the healing of infection, we come to know about the blockage of the tubes, the damage of the tubes. Okay, so if the diagnosis is still unclear, then what we do is obviously we see everything under vision. So laparoscopy, another fantastic tool, not recommended during the acute infection. Please note that it is. I'm not talking about the acute infection and laparoscopy. I'm talking about the if there is some if there are signs and symptoms of a pelvic infection and we are not able to diagnose properly with any other means, then obviously laparoscopy is going to help us to see the pelvic region, the uterus, the tubes, the patency of the tubes, the ovaries, any tube ovarian mass over there. And laparoscopy is such a fantastic thing that you can diagnose as well as operate. That means therapeutic as well as diagnostic as well as therapeutic. So the patient will have a great effect after the clearance is done. Her lifestyle will be better, and obviously antibiotic cover is needed. So laparoscopy is another tool. Then endometrial biopsy to diagnose. The doctor will we are going to insert the thin tube into the uterus. That is hysteroscopy. We do hysteroscopy as well as laparoscopy. Both the things are done, and we take the biopsy from the particular region wherever we have suspicion. Okay, so suspicion and treatment. So what are the treatments? So prompt treatment with medicine can get rid of infection that causes PID, but there is no way to reverse any scarring or damage to the reproductive tract in PID which might have caused. Means whichever was the old infection because of which the fibrosis has occurred or the tissue is damaged, it is not going to get reversed. Okay, so it's not that the tubes were severely damaged and tubes were blocked, fibrosed, and then the laparoscopy or medicine is going to reverse that, and then the tubes are going to be again patent, or and then improving the chance of pregnancy difficult. Because see, these are all very delicate organs, especially when you talk about the tubes. So the damage which has already happened is not going to reverse, but then yes, the timely diagnosis and therapeutic intervention is going to prevent the damage in future, the further damage to the reproductive tract. So first thing what we describe in the treatment of PID is antibiotics. So we usually prescribe antibiotic which is going to be effective against the large group of bacteria or helminthic infections. Okay, and when we are in doubt, then we may do culture and sensitivity also. We many a times set the vaginal swab for the culture and sensitivity to see whether the given antibiotic is effective for the given patient or not. The second thing is treatment of the partner. Then, obviously, just like we discussed, if the partner is suffering from diabetes, if the partner is suffering from infection, then that infection is supposed to be treated. Ideally, both the partners should be treated together, because see, if you treat one partner and leave another partner, then again they are going to share the infection and the effect is going to be zero. Okay, so it is better to treat both of them together and get rid of the infection. Temporary abstinence, very necessary. Avoid sexual intercourse until the treatment is completed and symptoms are resolved. If the patient is pregnant, seriously ill, have suspected abscess, or haven't responded to oral medications, then they may need hospitalization. They may receive IV antibiotics, which are most of the times more effective, followed by antibiotics oral. Then surgery is rarely needed. However, if abscess ruptures or threatens to rupture, we may have to take an emergency decision and do it in emergency. So, if the patient is not responding to the antibiotics, then obviously the patient needs hospitalization, and if required, then we do laparoscopy or hysteroscopy as whenever it is required. So PID is most often caused by sexually transmitted infections. Finding out that some patient has got sexually transmitted infections can be traumatic for the couple. But then yes, timely diagnosis and timely intervention is going to protect them and prevent further complication in futures. And just beware that whenever you take treatment, see to it that you go to a proper doctor. If it is a proper gynecologist, infertility specialist, they are going to help you. They are going to treat you in time. They are going to treat you with the right medication, and you will respond better and avoid further complications. So, so to summarize today's lecture, we saw what are the causes of PID, what are the complications of PID, and how to go about the treatment. So one question I think from Mrs. Arti, how long is the treatment done for PID? See, not necessarily that every patient will have same duration of the treatment, because some mild infection they just respond to the antibiotics for 7 days. Many times we give antibiotics for the period of 2 weeks, and a combination of antibiotics is preferred more because they are effective against the large group of infective bacteria or infective organisms. Then can PID come back after treatment? Another question. PID, yes, the recurrence is possible, because if the causative factor is not look after, the root cause is not treated, then it is difficult for the PID to get cure totally. It can recur, because see, different kind of bacteria, different strains of the bacteria are going to infect. Okay, so it is the PID, it is not that once it is treated it cannot come back. We have to have lifestyle modification of a patient. The causative element should be removed. Okay, so that is how we treat it and get rid of it. So how to avoid PID during ongoing treatment of infertility? uh, uh, Basically, PID is most of the times the cause for the infertility. So avoid PID is difficult, but then see, many times it is because of some interventions, and whenever there is intervention, I think they are covered with the antibiotics. So it is not that the infertility treatment is going to be the cause for pelvic inflammatory disease. I don't think so. So many a times other interventions like DNC and other procedures like copper T insertion and all, if are not done properly, not under aseptic precautions with the proper cover of antibiotics, then that is usually the root cause of PID. So I think that was the last question, and it was a fantastic session, and I think common problem we discussed today, and I hope the viewers are benefited by this talk. And we are here at Apollo Fertility for your further queries, and we welcome your queries. And please see us whenever you feel like. We are available for helping you. Thank you so much. I think we're done with the questions. Shall we conclude today's session?
Yes, ma'am. Thank you so much. It was a wonderful session. It
Yeah,
was
thank you, sir.
very
Thank you.
insightful. Thank
Yeah,
you, ma'am.
thank you. Bye bye.
Have a good day. Yeah. Bye.